In order to win it, we need to have enough votes in Congress, and we need a president that will sign it, right? That's the first and most important thing. So right now, HR 676, a majority of the Democratic caucus has signed on for the first time ever. A majority of the Democratic caucus has signed on. None of the Republicans have. And in the Senate, for the first time ever, there's more than one sponsor. There are 17 sponsors, which again does not win, right? You need 51. But it's the first time ever that there's been more than one sponsor of single payer in the Senate. And so how do we move from here to where we need to be? One thing that I would say in terms of our ability to win, we probably need to avoid getting caught up in the specifics of policy, right? What we need to do is figure out how to put together enough organizational strength to get the concept through.
So you mentioned that for the first time ever, a majority of Democrats in Congress are now on the single-payer bill. Do we have any opportunities here in Florida?
We sure do.
Should we be targeting certain Democrats to try to convince them? And do we have any races that we should be involved in to try to flip those seats to single-payer folks?
In Florida, we created this single-payer network, the Florida Single-Payer Network, which is the first time really that all these disparate groups that had been working on single-payer, that we all really came together and said, we need one plan. We started out with 11 organizations that first came together and said we should form this group and make a plan. We already have 16, we're up to 16 now, which is fantastic. Progressive Sarasota is part of it. So we looked at like what would be the right approach for us in Florida. And some states, like in California, they're one of the largest economies in the world on their own, right? Not that we're not. Florida is a pretty large economy too, but so in California, it in some ways makes sense to have people try to carve out and have a single-payer system just in California, which they've tried to do and they're still struggling to do that. But in Florida, we assessed that we probably, since we couldn't even expand Medicaid, that we probably would not be able to create single-payer as a standalone state, right? So we could put a lot of energy and effort into that, but even let's say we were to be able to get the 1 million signatures needed for a constitutional amendment, and even let's say that we were able to win that vote in the face of massive, massive opposition from the people making money, how many people here remember when we got Everglades restoration? Yes. And the legislature just didn't fund it. Right. So, oh yay, we win single payer. Then it goes to the legislature. We're like, forget it. Let's use our effort to move the federal program, and then Florida will just be swept in like the rest of the country, right? Yeah. So we looked at the members of Congress who have endorsed HR 676. So there are 13 members of Congress from Florida who are Democrats, 6 of whom have co-sponsored HR 676, which is 3 more than we've ever had in the history of HR 676. So we are up to 6. And so that means that there are 6 more. Did anybody here, did Lois Frankel come on board for 676? Does anybody know? I had heard that she did. I have not been able to confirm that. But I've heard that she's on board. So that leaves Murphy from the Orlando area, not on board. But close to us all here, Charlie Crist. Not on board. Shockingly not on board. We have had so many meetings with him. We've had rallies out at his office. Everybody's always like, he's this close. He hasn't done it. So that's someone who's near us that we could put some pressure on. There are some others across the state. There's like the four Dems that we think we could probably get on board. And then there's one Dem that we think we probably never will. She's from South Florida. We think probably she's not going to come on board. She's been pretty adamant about not supporting single payer. Although she did recently make a comment that made me think that maybe she needs to tack to the left because she's in a lot of trouble, which would be great. So if she did, fabulous. But I'd leave that to the South Floridians. Let them fuss with her. We need to fuss with the folks who are in our neighborhood, right? So I think that for us, the main person that we want to focus on is Charlie Crist. He's the closest one to us here. So that's one thing. Another thing is we need to reach out to the senators to support 1804. And so I don't know how many of you have seen this petition that's floating around. If you have not signed it, you should. Anybody who's a resident of Florida. They're doing these petitions nationally to try to move as many senators as possible onto 1804. Again, just, you know, in terms of like the reality of politics, my guess is Rubio is never going to come on board. Just guessing. I think that Nelson will be hard to get. I think we have to do a lot to get him. Maybe after he wins next time.
I was going to say because he,
Yeah, maybe after his next vote. Although I think that we should be talking to him as single-payer advocates. We should be talking to him about the voters in Florida support this. If you move to the left on this question instead of hiding from it, you would pick up support. We're going to bring these petitions to him. We're going to try to sit down and talk to him about this and see if we can get him on board. And then the other thing that we're doing, there's two other pretty cool things that we're doing. One is we're trying to research how much would all of these public employers save if we had this Medicare for All system. So this idea of like in Sarasota, it's $28 million just for the school system. If you extrapolate that out, it's $1.5 billion for the state to spend on public education. What are some other counties? Like what are some hard figures for other counties? And how much money for real would that save? And then one of the things, I'm sure you guys all know this already, but in these legislative delegation hearings, right? So every year before the legislature, between October and January, the legislatures from every county pull together a public hearing, and you can talk about whatever you want for 3 minutes. Anybody can talk about anything they want for 3 minutes. And so one of the things that we've been doing is having folks go to these legislative delegation hearings and talk about single payer and how much money their county would save if we had this Medicare for All system.
Yeah, so basically we got 3 minutes. Progressive Sarasota got 3 minutes, and we used our whole time for this. And I just gave testimony, and I shared the figures, the amazing figures about how much money we'd save to our legislative delegation, and they looked interested, and then hopefully they'll have a radical change of view.
The ask was for them to issue a proclamation asking Vern Buchanan, Marco Rubio, and Bill Nelson to support single payer.
So every county can do this, right? So we go to the legislative delegation hearings. These are people that are elected officials, right? They are the state reps and state senators who represent for that county, right? So you want to get this issue in front of them and say, can you move our member of Congress to support this? They're all pals. It's not like the state reps and the U.S. members of Congress, it's not like they're not pals. Of course they are.
And just as one additional thing, I mean, even, we do that, but also there was a videotape. Arlene made a videotape, so we pushed that out on Facebook, pushed out some facts on Facebook, because a lot of it's public education, as you've been saying.
Right.
So you can lobby, but there's also the added benefit of getting that out to people as an educational piece.
Right. So the Charlie Crist Town Hall, where a nurse stood up and really pressed him on, this is, laid out all the facts of why we need single payer, and, his response was, well, I haven't read it yet. It's like a page. It was pretty ridiculous. But he's, so now we're like, okay, so now you've read it, now what, right? The other thing that people can do is you can go to the county commissioners. You can go to your school board meetings. These are all public meetings. These are all places where there are people who come as part of the community, and there's always a public portion. You can get up and you can say whatever you want. Like, you can stand up and you can say, okay, Sarasota School Board, you could save $28 million a year if we had Medicare for All in this state, in this country. And think of what you could do for the kids, and you can even dream up things like, what would you do with $28 million, right? What are the things that you would do in the schools if you had $28 million a year to do it? And, make a little presentation about what could be done to improve the quality of education, and then ask them, you're part of the elected, officialdom of this county. Go talk to Vern Buchanan and ask him to support this. Go talk to Bill Nelson and ask him to support this, right? And so, or even pass a county or municipal resolution saying the city of Sarasota supports single payer or Medicare for all as a way to improve, health and well-being of our community, right? I mean, there's all kinds of things that you can do that bring it into the public, bring it into the sort of public realm, and open up opportunities for people to talk about this so that when the question comes up, well, if other people get into Medicare, won't I be worse off? Right? Like you want to be thinking about how are we going to talk to folks and preempt those questions.
We need someone like the CEO to do an analysis and say, this is how much it's going to cost, and that in fact our plan.
So Robert Pollin, who's an economist at the University of Massachusetts, has done numerous studies about the cost of single payer. I don't believe he's done one sort of for like what the national plan would cost as compared to what is currently spent on healthcare, but all the figures show that what is currently spent on healthcare, including the out-of-pocket that people spend, and what is like just the overall cost, that this is very doable. From my perspective, the first way to do it is we don't need to be, I don't think, we need to be looking at what is the national cost versus the national cost in the two systems. I think we need to be looking at the things like Sarasota public schools, right? How much are they spending as compared to how much they would have to spend? Because the studies that were done show that a 6.25% tax, payroll tax and then personal income tax, right? That tax would fund this. Most people are going to be better off. Most employers are going to be better off. The thing that's shocking to me is when you have these large employers who will not support Medicare for all. Right? So you look at Disney, right? They're the largest employer in the state of Florida. In a million years, they will never support Medicare for all. Wow. And you wonder why? Because they would save a ton of money, right? Because of where they're in the market system, right? They would have to betray everything they believe about how an economy should work and how markets work, right? This becomes ideological for them, right? They cannot, in their own good conscience, they can't say, yeah, we should do this because it would be better for us. It won't in the end be better for them, right? Because they probably own the stocks. They probably are making money hand over fist from their involvement in the for-profit system. Just because as an employer they would save money does not mean that as a sort of a titan of capital, right? They still make more money. Yeah.
As part of a larger entourage, which is part of the Koch brothers octopus. They're all locked in with the ALEC group. And so they don't go against what is in their best corporate interest. We have a corporatocracy today. That's reality. And the libertarians, the Koch brothers, do not want to have anything looking like socialism. And I think that's where Walt Disney is at, the whole program.
I will point out, though, the new generation, millennials and younger, those of us from the older generation, you know, the word communist, socialist, right? We all kind of go, oh, be careful, don't say that. Younger people don't care. They did not grow up in the Cold War era. They're like, whatever. Like, socialism, awesome. You know what I mean? Like we need to not be afraid of it anymore. Right?
Well, and I know that you're thinking numbers, and when we start trying to sell this to people, we need to be talking in dollars because that's what people understand. But I think that something that we're missing here is we need to sell this in human capital. When we're saying 45,000 a year, like how are we going to pay for this? 45,000 people a year are dying from preventable deaths because they don't have access to health insurance. How much does that cost us?
How much is that?
47% of people who are paying for health insurance are not using it because they cannot afford the deductibles and the copays. How much is that costing us? How many people are on their deathbed before they go to the emergency room because they've been sick for 6 months and haven't had the money to go to a doctor? How much is that costing us? So I think not only in terms of dollars, we need to be thinking about this and trying to sell this to people also on the terms of human capital. What is this costing us as a society? You know, we're only as strong as our weakest members, and we're only as powerful as we choose to be. And when it comes to the harm that our insurance companies and our government and our pharmaceutical companies and our for-profit hospitals or systems are doing to patients, to me, it doesn't matter how much more. I saw an interview with just a gentleman on the street who lives in Canada. And they were asking him about Medicare for all in the United States. And he said, yeah, I would support that. And they said, well, of course you do, because you live in a country where you have Medicare for all. And he said, yeah, but you know what? I don't care. I'll pay a little bit extra. If it means that 6-year-old child gets the heart transplant that he needs, I'll pay $100 a year extra. I don't care. So we need to be in that same position. Sometimes it needs to not necessarily be all about money. It needs to be about what is the right thing to do and what is the humane thing to do.
As Michelle was saying, we need to take the moral high ground and then follow it up with, not only are we morally right, but we're also factually right. And so I agree, we do need both, but we need to lead with the moral high ground on this question.